In this video, we will explore this silent condition that affects millions of people worldwide. You might be living with prediabetes right now without even realizing it. But rest assured, we are here to help you understand these crucial signs so you can take preventive measures. And, in the end, don't forget to subscribe to the channel for more health information. Now, let's delve into each of these 12 signs of prediabetes, examining them in detail so you can be well informed about this condition. Sign 1. Excessive thirst. One of the first signs of prediabetes is constant thirst that doesn't seem to quench, even after consuming significant amounts of water. This happens because excess glucose in the blood places an additional burden on the kidneys, forcing them to work harder to filter out the excess sugar. The result is constant dehydration, translating into unquenchable thirst. This sign can go unnoticed, but it's crucial to observe the abnormal increase in thirst, especially if it persists for an extended period. Sign 2. Frequent urination. If you notice that you're going to the bathroom more often than usual, especially at night, this can be a revealing sign of prediabetes. Elevated blood glucose levels overload the kidneys, causing them to eliminate more fluid in the form of urine. This results in a constant need to urinate. If this pattern becomes a regular occurrence in your life, it's an alert that should not be ignored. Seeking medical guidance to investigate the possible cause is essential. Sign 3. Fatigue. Chronic fatigue is a symptom often overlooked but can be a revealing sign of prediabetes. When glucose isn't efficiently absorbed by the body's cells, you don't get the necessary energy for your daily activities. As a result, you may feel constant tiredness, even after a proper night's sleep. If this persistent fatigue becomes a regular part of your life, it's essential to investigate its causes, as it may be related to prediabetes. Sign 4. Excessive hunger. Intense and constant hunger, even after meals, can be a sign of prediabetes. This occurs because blood sugar is not efficiently absorbed by the body's cells, leaving your body lacking energy. As a result, you may feel insatiable hunger, frequently seeking food. If the feeling of hunger seems persistent and unusual, it's an important clue that deserves medical attention. Sign 5. Unexplained weight loss. While it may seem contradictory, unexplained weight loss is a sign of prediabetes that deserves attention. This happens because when the body can't effectively use glucose as an energy source, it turns to burning fat and muscles to compensate for the lack of energy. As a result, you may begin losing weight, even without significant changes in your diet or lifestyle. If you notice unexplained and unplanned weight loss, it's important to investigate the possible causes, one of which could be prediabetes. Sign 6. Blurred vision. Vision problems, such as blurred or hazy vision, can be a side effect of prediabetes. Excessive glucose in the blood can damage the blood vessels in the eyes, impairing the ability to focus and maintain clear vision. This condition is known as diabetic retinopathy. If you notice changes in your vision, such as difficulty reading or seeing sharp objects, consult an ophthalmologist and consider an evaluation for prediabetes. Sign 7. Slow healing wounds. Wounds that take a long time to heal can be a crucial sign of prediabetes. Elevated blood glucose levels affect the body's ability to repair itself. Excess glucose interferes with the healing process, making the closure of cuts, scratches, and wounds slower than expected. If you notice that minor injuries take longer to heal than usual, this can be a warning sign. Slow healing is a symptom that deserves investigation, as it may be related to prediabetes. Sign 8. Recurrent infections. If you are experiencing frequent infections, such as skin infections, gum problems, or urinary tract infections, it can be a sign of prediabetes. High blood sugar weakens the immune system, making it more vulnerable to infections. Excess glucose provides an environment conducive to the growth of bacteria and fungi, leading to recurring infections. If you find yourself in a sequence of infections, it's time to consider the possibility of prediabetes and seek medical advice. Sign 9. Tingling or numbness. Feelings of tingling or numbness in the hands and feet can be a sign of prediabetes. These symptoms are often associated with nerve damage, a condition known as peripheral neuropathy. High blood glucose can harm the peripheral nerves, affecting communication between the nervous system and the body's extremities. If you experience constant tingling, pinprick sensations, or numbness, it is essential to seek medical guidance to evaluate whether prediabetes is contributing to these symptoms. Sign 10. High blood pressure. Prediabetes and high blood pressure are often interconnected. Elevated blood glucose can damage blood vessels, resulting in increased blood pressure. Blood pressure control is crucial, as untreated hypertension can lead to severe cardiovascular complications. If you already have prediabetes or suspect you are at risk, it is essential to regularly monitor your blood pressure and take measures to keep it under control. Sign 11. High cholesterol. Prediabetes can cause imbalances in cholesterol levels, increasing LDL, bad cholesterol, and triglycerides in the blood. These changes in blood lipids are risk factors for heart disease. Elevated blood sugar can affect fat metabolism, contributing to increased LDL cholesterol and triglycerides. Therefore, controlling cholesterol levels is essential for preventing cardiovascular diseases in people with prediabetes. Sign 12. Family history. If you have close relatives, such as parents or siblings, with type 2 diabetes, your risk of prediabetes increases. Genetics play a significant role in the development of this condition. If there is a family history of diabetes, it's important to recognize this risk factor and adopt preventive measures, such as regular medical evaluations and lifestyle changes, to reduce the risk of developing prediabetes. Now that you have a more in-depth understanding of these prediabetes signs, it's crucial to pay attention to these symptoms and seek medical advice if necessary. Early detection and effective management are essential to prevent progression to type 2 diabetes. And, of course, don't forget to subscribe to the channel for access to additional health and well-being information. Together, we can work to prevent prediabetes and promote a healthier life.